We typically see patients every 3 months the first year, usually every 6 months after that. So those visits are about screening patients for any symptoms that could be suggestive of metastatic disease. So it's really generally a symptom-directed workup and presentation. Metastatic breast cancer is breast cancer that has spread from the breast to other parts of the body. So that would be most commonly bone, followed by lung or liver, sometimes lymph nodes, and it can also sometimes spread to the brain. If cancer has spread to the bone, the most common symptom someone will present with is bone pain. And we all get aches and pains, but the key finding here is that there's no explanation. There was no injury, say, there's a new pain somewhere, and it's just not getting better or getting worse. That would be something to call your oncologist about. In terms of lungs, patients can sometimes present with a cough that doesn't go away, sometimes shortness of breath. And liver metastasis can sometimes present with a change in appetite, nausea. In a very advanced situation, sometimes people present with jaundice if there's obstruction of the bile duct and can present with yellow eyes or jaundiced skin. Breast cancer can spread through the lymph nodes under the arm and travel by lymphatic channels or blood vessels to other parts of the body. You worry about brain metastasis if someone presents with new dizziness, new blurry vision, new headaches that are persistent that are not getting better, change in personality, memory changes, things along those lines. About 10% of breast cancers present initially with metastatic disease, but the majority of patients present with early-stage breast cancer. And although we're doing so much better in terms of curing so many of those patients, some of those patients ultimately do recur with distant metastases. It is not recommended to do routine blood work or routine scans in the follow-up of early-stage breast cancer patients looking for metastatic disease, and that's really because it's never been shown to be helpful. So it's very symptom-driven. So we see patients in follow-up usually every 3 months the first year, every 6 months or so after that, and we do a very careful history about any new symptoms they might be having as well as physical exam. And I think it's really important to educate people about how well people can do, not everyone, but a lot of patients can do very well with metastatic disease and live many years, sometimes with good quality and quantity of life, do normal things, continue to work, go to bar mitzvahs and weddings, and live their lives. Patients are living sometimes without evidence disease for many years, more and more. We're seeing more and more of that.